One of humanity's oldest concerns is the restoration of life. Early attempts to revive the dead and dying were often primitive and ineffective. Death looks like sleep, so man tried to arouse a victim by loud noises, slapping and restoring warmth to the body with live coals. In drowning cases, the inversion method was the treatment of choice in Europe. By 1773, the Dutch became quite adept at rolling victims over barrels. In 1812, the barrel was replaced by a horse that bounced the drowning victim. The bouncing method caused some air exchange and occasionally even met with success. The Royal Humane Society of London advocated the use of bellows for resuscitation in 1837, but the bellows proved better at reviving fires than reviving people. More sophisticated methods followed. In 1857, England's Dr. Sylvester kept the victim face up to perform the first manual method of artificial respiration to be universally accepted. In 1903, the victim was turned face down for the Schaefer prone pressure method. Then, in 1932, the Holger-Nielsen technique was developed, and its use became widespread. Following World War II, the American Red Cross and the United States Army sponsored a coordinated research program to determine the best method of artificial ventilation. A summary in the 1958 Journal of the American Medical Association stated, "These studies have indicated the unequivocal superiority of mouth-to-mouth resuscitation over all manual methods in all age groups." This scientific milestone brought about dramatic rescues in suffocation, drowning, choking, and other cases where breathing had stopped. But if the heart stopped, circulation also had to be restored. In 1960, Doctors Cowan, Hoven, Knickerbocker, and Jude at the Johns Hopkins Medical School made this breakthrough by developing a technique for artificial circulation. Today, artificial circulation combined with artificial ventilation is the recommended technique for emergency resuscitation. It may be needed in heart attack, electric shock, drowning, suffocation, gas poisoning, overdose of drugs, or any time that respiration or circulation have stopped. During normal respiration and circulation, oxygen is carried to all parts of the body by the cells in the bloodstream. If breathing or heartbeat stop, the brain, which is the most sensitive tissue of the body, may become seriously damaged after 4 to 6 minutes without oxygen. Chances of recovery decrease with each passing minute. Every second counts during these critical moments when a life hangs in the balance. To prevent irreparable brain damage, you must know the principles of basic life support. They are the ABCs of resuscitation. A, open the airway. B, restore breathing. C, restore circulation. After determining unconsciousness, the first step is to open the airway. In this training session, an airway model is used to demonstrate this principle. During normal breathing, the air passages are open. In an unconscious person, the head flexes and the jaw falls back. The tongue, which is attached to the jaw, falls against the throat and blocks the airway. The first thing in an emergency is to open the airway. The recommended method is head tilt. With one hand on the forehead, tilt the head back to maximum extension. Head tilt may be supplemented by neck lift. Head tilt can also be supplemented by chin lift. Another method to open the airway is jaw thrust. Place the fingers at the angles of the jaw and thrust the jaw forward as you tilt the head back. Often, opening the airway is all that is necessary for breathing to resume spontaneously. If breathing does not resume, immediately begin breathing for the victim by the mouth-to-mouth method. Keep the head tilted back. Seal the nose to prevent air from escaping. Open your mouth widely, take a deep breath, make a tight seal around the mouth, and blow in until you see the chest rise. Remove your mouth and watch the chest fall as the victim exhales. Repeat every 5 seconds. With every breath, you should see the chest rise and fall, and you should feel and hear the exhaled air. In an actual emergency, the initial maneuver after opening the airway is to give 4 quick, full breaths without allowing for full lung deflation between breaths. Those first 4 breaths assure good lung expansion. In cases where mouth-to-mouth is not effective, mouth-to-nose may be substituted. Lift the chin to close the mouth. Seal the lips with your cheek or thumb. Then blow through the nose. Sometimes it may be necessary to open the mouth for exhalation. When opening the airway and breathing for the victim are not enough, restore circulation. The heart is a pump that forces out blood and produces a pulse with each contraction. This heart is beating normally and is monitored on an oscilloscope which shows the normal electrocardiogram. This is ventricular fibrillation. The individual muscle fibers contract independently without coordination, a useless activity that does not circulate blood. This condition occurs frequently during heart attack. This is cardiac standstill. When the heart stops, there is no circulation or pulse, and no activity is recorded on the oscilloscope. However, in emergencies, you must rely on the pulse to check the heartbeat. To determine if there is an effective heartbeat, check the carotid pulse by placing the fingers on the Adam's apple and sliding them into the groove at the side. If no pulse, restore circulation by external cardiac compression. The heart lies in the middle of the chest, beneath the breastbone or sternum. Compression should be over the lower half of the sternum, but not over the xiphoid, which is the lower tip of the sternum, since pressure here may cause internal injury. To locate this position, run 2 fingers up the rib cage to the notch where the ribs meet the sternum. With the middle finger in the notch, place the heel of the hand on the lower half of the sternum next to the index finger. Then place the other hand on top. Compress the sternum straight downward with enough pressure to move it 1.5 to 2 inches on an adult. The compression of the heart between the sternum and the spine, as well as pressure inside the chest, forces blood out. Relaxation of pressure allows the heart to refill. Use the heel of one hand only and do not let the fingers touch the chest. This minimizes the possibility of rib fracture. The fingers may be interlocked to keep them off the chest. For maximum effectiveness, the victim must be on a firm surface. Cardiac compression circulates blood, but does not produce adequate ventilation. It is mandatory that it be combined with mouth-to-mouth breathing. The combination of artificial ventilation plus artificial circulation is called cardiopulmonary resuscitation, or CPR. CPR is performed best by two rescuers. One compresses the heart once a second, while the other interposes a breath between each 5 compressions without any pause in the compressions. Ventilation is more effective when done between compressions because you are not inflating against the compressions. The compression rate is 60 per minute. The compressions should be regular, smooth, even, and uninterrupted with a ratio of 50% compression to 50% relaxation. The hands are relaxed after each compression, but remain in contact with the chest. One rescuer may count out loud to maintain the rhythm.
1, 1000, 2, 1000, 3, 1004, 1005, 1000, 1, 1002, 1003, 1004, 1005, 1000.
During two rescuer CPR, the rescuers can switch positions. The rescuer performing compressions directs that a switch take place at the end of a 5-to-1 sequence.
1002, 1003, 1004, 1005, 1000, switch 1002, 1003, 1004, 1005.
Then he checks for spontaneous heartbeat for 5 seconds at the time of switching positions. There is no pulse. He gives a breath immediately.
No pulse. Continue CPR.
An important rule is never interrupt CPR for more than 5 seconds. When there is only one rescuer, he performs CPR alone by compressing the chest 15 times, then giving 2 quick breaths. To compensate for the time lost inflating the lungs, the compression rate must be faster, 80 per minute. This achieves a rate of approximately 60 per minute. To help maintain a proper rate, you can count to yourself.
1 and 2 and 3 and 4 and 5 and 6 and...
In review, when there are two rescuers, compress the chest at a rate of 60 per minute and interpose a breath between each 5 compressions without a pause. Remember, with two rescuers, the compression-ventilation ratio is 5-to-1. The compression rate is 60 per minute. If there is only one rescuer, compress the chest faster at a rate of 80 per minute, and after each 15 compressions, give 2 quick, full ventilations. Again, with one rescuer, the compression-ventilation ratio is 15-to-2. The compression rate is 80 per minute. In review, the steps are: check for consciousness. If unconscious, call for help. Position the victim and open the airway. Look, listen, and feel for breathing. If absent, give 4 quick, full breaths. Check the pulse. If absent, begin CPR at once. After the first minute and every few minutes thereafter, stop compression. Check the carotid pulse for a return of spontaneous heartbeat. If no pulse, ventilate the lungs, then quickly resume CPR. CPR techniques are modified somewhat for infants up to 1 year of age. Ventilate by covering the mouth and nose and using small puffs of air to inflate the lungs every 3 seconds. If air distends the stomach, expel it. To do this, turn the infant to the side to prevent possible aspiration of stomach contents and press on the upper abdomen. Then quickly resume ventilation. To check the infant's pulse, feel for the brachial artery on the inside of the arm between the elbow and the shoulder. If pulse is absent, begin CPR. Place 2 fingers on the mid-sternum between the nipples and compress the chest 1/2 to 1 inch at the rate of 100 times per minute. Inflate the lungs after each 5 compressions. For children from 1 to 8 years of age, effective compression can be achieved with the heel of only one hand. Compress the chest 1 to 1.5 inches at the rate of 80 per minute. To review, for infants up to 1 year of age, use 2 fingers to compress the mid-chest 1/2 to 1 inch at the rate of 100 times per minute. For children from 1 to 8 years of age, use the heel of one hand to compress the sternum 1 to 1.5 inches at the rate of 80 per minute. For infants or children with either 1 or 2 rescuers, ventilate the lungs between each 5 compressions. You have seen demonstrations of the ABC principles of basic life support. The following are reenactments where 1, 2, or all 3 of the ABC principles are used to save a life. After fainting, mild heart attack, and other conditions, failure to breathe may be due only to the tongue blocking the airway. Open the airway. Opening the airway and the return of spontaneous breathing means successful rescue. Suffocation is a leading cause of accidental death for children under the age of 5. If breathing is absent, give 4 quick breaths. Check the pulse. The pulse is present, but breathing is absent, so continue mouth-to-mouth ventilation. With small children, cover both the mouth and the nose with your mouth. Pain and discomfort in the center of the chest are early warning signs of impending heart attack. This may be followed by radiation of pain to the shoulders, arms, or neck. Weakness and sweating also may be present.
Hey, Ray?
Determine
Ray.
unconsciousness. If unconscious, open the airway. Look, listen, and feel for breathing. If absent, give 4 quick breaths. Check the pulse. If absent, begin CPR at once.
Come on! Quick, Val, get emergency, 911. Get an ambulance, quick.
The second rescuer feels the pulse to check the effectiveness of the compressions. The pulse is present. He tells the first rescuer to stop compression. He checks for spontaneous heartbeat. There is no pulse. He gives a breath, and 2 rescuer CPR begins. Where there is a well-organized community-wide rescue system, trained personnel and portable equipment are quickly dispatched to the scene. Effective CPR by the first rescuers at the scene can sustain a victim of cardiac arrest until advanced life support arrives. As soon as trained paramedics arrive at the scene, preparations are made to provide advanced life support. The heart rhythm is determined with paddle electrodes.
He's in V-fib. Everybody clear?
A defibrillator is used to restore an effective heartbeat.
We've got a palpable pulse.
He's back to normal sinus rhythm.
The rescue squad contacts the hospital via telemetry.
Squad 9, over. Community hospital, we have a full arrest. Request permission to start an IV, over.
An intravenous lifeline is started so that fluids and drugs can be administered. Breathing is assisted with a mechanical ventilator. An ambulance and crew also have been dispatched to the scene to assist.
Now have normal sinus rhythm. Assisting breathing with the mechanical ventilator.
Give him a 5-second shot. Seeing the vitals.
Lead 2 ECG to follow, community.
BP 108 over 60, and the pulse is 84.
Community vital signs are blood pressure 108 over 60, pulse of 84. Respirations are shallow and assisted, over. Tim for community.
Lidocaine on board.
Community, we have the lidocaine administered at this time. We're preparing to transport the patient to your location.
6025 prospect.
The patient has received advanced life support from trained rescue personnel at the scene. He is now stabilized and can be transported to the hospital.
South 4, 7, 3, 4, 1/2.
Prompt action and careful attention to the details of CPR and emergency cardiac care have restored the pulse of life to another heart that is too good.